Hi, this morning we want to look into the opposition and just unit LO2 um working in partnership in health and social care. Unit 2. We had a wonderful time yesterday with Unit 1. And Unit 2, we are going to look into um how learners need to understand how to establish and maintain a working relationship with others. And in this unit, we'll look into um, how to evaluate procedures, how to evaluate procedures, how to evaluate procedures for effective working relationship with others, or and then to analyze common objectives used when working with others within the boundaries of own role and responsibilities. So we have two forms of 2.1 and then 2.2. All right. Okay. Um, let me quickly look into just today. Then we could look into the LO2 kind of format that I can share with you. So share all together. Share, and then we take it from there. How the screen can be seen. Okay. Let me see the screen. We need our full names. Full names. Please use type in any full name when you join us. All right. So go to share. Already sharing. It's a week. Start country. Okay. So we had yesterday we spoke about partnership working, the key elements of partnership working, the importance, barriers, and how to deal with that. We identified that one of those key elements in partnership working had to do with communication. Okay. We'd also realize that there are problems where there's conflict of interest, where the roles of professionals are not clearly defined. And for that reason, um, it's conflict each other. You don't really can't tell two or three people may be doing one certain particular job, and it's quite worrying. But we did and emphasize that there are ways of addressing those conflicts and those issues that comes or that crops up within partnership working. Okay, we also mentioned what we call the multidisciplinary working pattern where you have people chosen from different diverse working environments, and what you try to do is what we call the joint partnership working. So you join them together to achieve one common goal, and these are very key in our processes, ensuring that one is able to so to speak, one is able to understand when we talk about partnership working. Okay, now what then is partnership working? And we did explain that partnership working refers to a broad range of actions and can easily be defined as two or more groups coming together to achieve a common goal. We did mention that yesterday. Okay, and what partnership in healthcare means, obviously, is that it's a collaborative relation between two or more parties based on trust, equality, and mutual understanding for the achievement of a specific goal. Partnership involve risks as well as benefits, making share accountability critical. Yes, it's quite important that accountability plays a major ingredient in partnership working because the various people who have been brought together to sort of achieve a common goal. You might or you should be accountable. You might have a team leader or a manager that you need to report to, so to speak, to ensure that you are in line. For instance, if it's a project that is meant to be completed in the next 1 week or in the next 3 months, there should be some kind of monitoring, or there should be a leader that monitors the deliverables for those projects. Okay, so the project may have a project time and a project and deliverable, and therefore between the project start and the project end, those periods there should be someone that monitors or regulates your time, whether you are behind time or whether you are above schedule. All right, very, very important. And so it brings about some risk and benefits, but also to sort of bring to bear that there is accountability part of partnership working. You might first of all account to each other as partners, but you may also have a superior that you need to report as to whether you are achieving the purposes that you have been formed or to do. Okay. Then you'd Partnership can be formed between individuals or agencies, organizations with a shared interest in social care. Partnership working ensures individuals receive high quality joint up care support. Think about individuals and teams you work with. Write down some of the partners you work with. So I've just mentioned, we mentioned yesterday that it cut across every aspect of. So you may have voluntary, community, and social enterprise. I did mention that if in the UK somebody has a child, you have different people coming. Most times they may be performing same routine checks and all that, but everybody has a role they play. You have the midwife coming, or you may have the community nurse coming, you have a social worker coming, and most times they are trying to do something similar and they work with other, they work together. So most times a social worker also, I'm going to call your support worker or your assessment worker. So it's partnership working is an extension of each other's work, where everybody has some kind of role they play in the upbringing or the well-being of the child. Where you have 1 year, somebody will need to come and do assessment of the child to see his well-being, check the weight and all that. So you will also have community people come in. You may have groups, voluntary groups coming and doing checks and all for the child. Some may come around to even help in what we call sure starts, where the child will need to be attending those what do you call centers to sort of bring some kind of exercise or an environment where the child can play. So these are all voluntary and some kind of governmental wings that helps in building partnership working. Okay. Now to support the NHS England developed a partnership that the following truths and resources. So we have principles for VSCA engagement. We also have the VCSE health and wellbeing programs. And then also you have the VSSA advisory group. Okay. Okay. Now, the principles of engagements are the NHS England, and then we have the VCSE organization. Okay. It brings to bear an inclusive and reach out community program. Okay, where you ensure that engagements with the VCS sector is inclusive, engaging with organizations interested in the life course and the whole person as effectively as those working to improve the treatment of individual conditions. Challenge inequalities. You work with VCSE organizations to prioritize the voices for those who are otherwise seldom heard, just to bring to and bear those who may not have a voice. Okay. And then to demonstrate impact and build evidence base to advise and support the VCSE sector to demonstrate how their involvement achieves greater impact and value. Okay. All right. Let's crack on. And then you have adopt to production. It talks about being transparent, be open about your ambition and aspirations and constraints in and how we engage. Okay. And then the challenge and be critical. Provide so to speak, provide and development and delivery programs working for the same goal. Like I did indicated, you have to recognize that the VCSC sector are essential partners in helping us to meet our obligations through the Equality Act and address health inequalities and ensuring that our programs meet the needs of the most disadvantaged. It's very important. Okay. And how do you achieve that? You have to recognize that NHS England are working for similar goals, better health and care for all communities. You can achieve much more in partnership. Okay. Where in being transparent, you have to be transparent about how they can support involvement, the diversity of those that represent and the scope of the environment. Very, very important. Okay. Very, very, very important that we need to take note of what the NHS do and the NHS England does and what the VCS also do. Okay. We would also identify the contribution that can be made to enhance partnership work. There should be that can be made to enhance partnership working. So there are about some circles of, so we can talk about a partnership working. Obviously, you inspire great ideas. Okay. You strengthen relationship. You add another dimension to, yeah, because what you could have done literally by yourself, and that would have taken longer time to do. The person that comes on board, you're able to add another dimension to it. You share expectations, you share risk together. You provide essential insights. It increases capacity. It provides greater opportunities, of course, new ideas and all that. So greater opportunities are open and it helps reach out to new audiences, of course, because you may have your limited audience, but the other person may also have his audience. So it grows wider audience reach out. Okay. Yeah. And provides additional venues. It also provides greater expertise, of course, because you have different people coming on board with different expertise, and therefore the expertise become maximized. Are we together? Okay. It also strengthens relationships. Okay. In partnership working, you build relationships. Okay. So you become bond to each other and then you are able to forge on to achieve your goals so easily. Okay. Good partnership working can be enhanced in many ways. One is having open communication channels, regular meetings, updates, just like handover, feedback meetings, and all that. Those are very key. Respecting each other for the roles and response. There must be respect for one another and accepting that we are different in our different expertise and in different roles. Okay. Collaboration with partnership. Working together, sharing services, workload, and resources. You are there to take out the burdens that may be on one person. So you share the burden together. All right. Setting objectives for staff, right? Very important. One of the ways is you have to set objectives. There must be some visionary. This ensures every team member has a role and aware of what they need to do. A clear objective. It should be a clear objective as to where you are arriving, what you seek to achieve within 1 year, within 6 months, and all that. And so that everybody can be accountable for what has been clearly defined for all. Okay. Having an open mind. You should be able to have an open mind so that people can flow with the ideas and come to you when there are any issues. Okay. And then adhering to the Care Act of 2014. The Care Act 2014 set out one place local authorities' duties in relation to assessing people's needs and their eligibility for public funded care and support. You need to be familiarize yourself with the Care Act. Okay. Yes, because the local authority duties in relation to assessing people's needs, and that forms under social care. You should be able to know the needs of people under the Care Act 2014. Okay, you need to comply. There should be adherence to the Care Act 2014. Other contributions that can enhance partnership working is one being non-judgmental in accepting that we are from different people with different backgrounds. We ought to try not to be judgmental. Okay, we have to try not to be judgmental at all. It won't help. Okay, being non-judgmental, mistakes happens. Don't hold this against a fellow colleague. This is where training, mentoring, coaching may be beneficial. Negotiating. Be able to negotiate and delegate services, tasks, and responsibilities between partnerships. Being assertive and confident. Assertiveness goes with confidence. You cannot be a team leader and not being assertive. You have to be very tough as a leader. You need to make bold decisions. So one of the key elements of a team leader or a manager that you ought to be very assertive. You have to be very principled in your stance and ensure that whatever you agree or seek to do, you need to have bold decisions. Not to say that you have to be rude, but you have to be assertive. This will lead to effective teamwork where every member is aware of their responsibilities, having shared goals to meet shared outcomes. Okay? Very, very important. Okay? In negotiating, you have to be able to negotiate and delegate services, tasks, and responsibilities between partnerships. Then you have to be able to, there should be evaluation on the strengths and weaknesses relative to the partnership working. Of course, we have to identify individual strengths and individual weakness so that those who are weak in certain area, you pair them up with those who have strength in that area. And that is how you build partnership working. So you may have people with strengths in a wide of skills available. Some may have natural leadership qualities, some able to coordinate service for service users, efficiency and effectiveness, better assessment, shared goals, and working towards shared or same outcomes. There may be weakness in terms of compromise may be required. Integration may be very difficult. There may be different agencies and disciplines may have different objectives. Discrimination between services. These are all things that may occur, and you can also choose to use the SWOT analysis to sort of help in this situation. Okay. And we can look into conflict. Yeah. You look at issues objectively. How can each issue be resolved? Who is the best person to resolve the issues that may have arisen? Okay. You have to look at different techniques of problem solving. You can define the problem, define the causes, generate ideas, select the best solution, and take action. Or you could also use the SWOT analysis. Okay. Bargaining. Decide who is best for what task. Have an open conversation. Negotiate with each other. Okay. Very, very important. You have to find out who is best for each task and have open and then negotiate. Make sure you pay them. Make sure you pay them. Okay. Yeah. Cooperative conflict, also known as mutual gains, interest-based and win-win affair can contribute to effective problem solving. You see, you try to bring people collaboratively. You have to be cooperative. Make sure that you're able to cooperate and deal with conflicts that arises within the group. Okay, and make sure that there's a win-win affair and it's fair across board, so that nobody feels that they've been sidelined or they've been maltreated. Okay, each party needs a goal and must be considered, with the net result that both parties maximize their outcomes. Challenge discrimination and report any concerns you may have to the necessary personnel or safeguarding leads. Okay. Evaluate their strengths and weaknesses in relation to partnership working. Okay. So evaluation, you have to have a good evaluation system set in place. A regular approval system with which will monitor the progress and outcomes. Okay. Gather feedback from families and friends of the service user and monitor the progress. That may also have independent regulator to take on this task. It could be a CQC, GMC, or MMC, where CQC is more to do with the organization's systems and all that. The GMC regulates doctors, and then the MMC regulates nurses. Okay, very, very important. So there should be a well-detailed evaluation system set in place. Okay, appraisal, which is very important. Appraisal, you need to have appraisal of your staffs, appraisal of the services that you render it, okay? And make sure you get a feedback system for family and friends. They are partners to the service user. They are partners to the service that you are rendering, okay? And you have to monitor the progresses. You have to monitor whether you guys are doing well or you're not doing well, or whether you are behind, or whether you're an average service provider or an excellent service provider. And CQC does well in that they are able to pay the assessment, um, confirm whether you are an excellent, understanding provider or service provider, or you are an average, or whether you are very poor, okay, in your service delivery. There should be development plan. Okay, establishing a partnership can be tricky, especially if you don't share the same vision and goals. Very, very important, because in partnership you have to be on the same wavelength, and therefore it's a huge risk, because you may have a partner who have different ideologies and different way of thinking, and you also have different way of thinking, and therefore you may have some kind of conflict. So it is important that you set up a development plan, a plan that guides you together and ensure that the mutual agreed goals clearly set up on your agreements. The plan, you have a plan that you follow and make sure that you are able to achieve that per the agreement that have been made in place. Okay. Maintaining partnership working can often be challenging. This takes time, patience, and good communication. Very important. We have to look at approaches to partnership working. Okay. You have to be clear and honest for start. It's very important that from the start or from the go, the partners are clear, are very clear from the start. There must be clear trust. How much each party should get. It is 50-50, it must be clearly defined. If it's 70-30, it must be clearly defined. So there's no problem in your developmental plan. Okay. So you don't disagree. Understanding partnership working. The aim of partnership working needs to be agreed and understood by all the partners. The partnership needs to be steered by clear, effective leadership, clarity on role. So it's important that to achieve that, you have other parties who are on board. You can appoint chairman, or board chairman, executives that would party to the what do you call it? Very important. Very, very, very important. And then you have Then you can proceed to, before you can improve on your own practice, you need to know what areas need improving. A good way to do this is to carry out a SWOT analysis on yourself. I did mention that. This will help you to identify any areas that may need improvement. Okay. Identify ways to improve own practice. Look at your own contributions. Are you meeting your targets? I mentioned that whether you are behind schedules or about or you are ahead of schedule. Okay. So you have to what? Look at your own contributions. Are you meeting your targets? Are you on track? Are you missing deadlines? Do you need a better organized, take notes, great? I did mention that. So these are all things that needs to be done just to ensure that you are on track or you are doing things right per your partnership. Okay. What is leadership style? What is your leadership style? We have common leadership style. We have the autocratic leadership style. We have the bureaucratic style. We have transformational leadership style. Okay, there are different types of leadership style. Now, the democratic leadership style, you need to adopt a kind of leadership style. Okay, you have to see how ways to improve on your practice. Okay, do you take on too much? Are you a people pleaser? Don't like to say no, or do you need to delegate more or rather take on more responsibility? These are all things that you need to assess along the line. Whether you love to please people, whether you take on more job, or whether you love to delegate or you want to do things by yourself. Obviously, you cannot be doing things by yourself entirely when the partnership is increasing. But you could do things by yourself when you are less number of people or when you have to do things within a expectative where there's not much people or you have the scope of delivery is not that much. If your scope of delivery is not that much or if your target audience are not huge, then you could be doing things by yourself, especially when your trust level is not quite established with your partner that you have on board. Okay. Okay. And then we could move on and say, so therefore, we can have an overall reflect on the practice. You have to look back every now and then at the past, look back at the past month or the last project or task you handled. Think back on how you did. What what would you change? How would you do this? Are there any areas of improvements? Very, very important. And what would you keep the same and carry forward into your daily practice? Okay. I repeat myself. You have to look back at the past month every now and then and see if the last project was done properly or there was any malfunctioning in your last project. Okay. I did explain to you that every project will have a start date and an end date or the delivery. So what are the achievables or the deliverables? Were you able to achieve your project's end date in time? Or did you take extra month to complete? If you have a target and say in the next 1 month you want to complete this project, were you able to achieve those projects within the month or you went beyond the month? These are things that you need to check in partnership. Okay. You have to think back on how you did them, what could have been done better, what would you have changed, and how would you do this differently? Okay. Are there any areas of improvement you need to look at? Whether it's a church, whether it's an organization, as a person, you need to even assess yourself that how best in a marriage or every situation, you have to say how best can you be the best husband or the best wife or the best child to. So everybody will need to have a cross-examination, and so is partnership as well, because you have two different people who have come together to establish a business. And so you need to ensure that both of you are able to manage yourself. Then you can also manage the business. Okay. And what would you keep the same and carry forward into the daily process? In carrying going forward, you have to look at the plus and minuses, those things that are not good for the businesses, and those which are good for the business. You take out those which are not good, and then you proceed on with the good ones. In fact, you maximize the good ones so you can achieve more. Okay. Then in partnership, we come in all shapes and sizes, depending on who is involved, why, and what they aim to achieve from the relationship. We can identify some common features. For instance, having a common vision, sharing both risk and benefits, having a sense of co-creation and contribution from all parties. Very, very important. In partnership, you are sharing, just like in marriage, it's partnership. You are sharing burdens together, you are helping each other so that one person doesn't get tired. Same is it, same is it in partnership in business as well. Okay, very important. So how can you measure the effectiveness of partnership working? Okay, here are some few points. Okay, here are some few points. In partnership working, one is able, so in partnership working, you are able to ensure, you need to look into the plus and minuses. You have to ensure that one is able to, one is able to, Hello? One is able to achieve in partnership working. You need to look into those of people who have come to in partnership. What are the do's and don'ts in achieving that? And so, as a student trying to come out with partnership, you need to ensure that your partner that you have your common vision with, you have to have common goals. Same in marriage as well. In marriage, it is partnership. So one is able to achieve those things and ensure that you are able to look into the nitty-gritties, the pros and cons. And normally we use what we call the SWOT analysis, where you are able to, in leadership style, whether you use the transformational leadership or the democratic leadership, but then you use the SWOT analysis to determine the strengths and weaknesses in partnership. So you do that to ensure that what are the plus and minuses. If there are projects that you guys have focused on as partners, you need to look at the individual strength that you have, and then you look into what you don't have as partners, and then you do your strength and your analysis. By the strength, you look at what does your partner have as a strength, and then you enhance it or you maximize it, and you look at the weaknesses that your partner don't have, and then you pair them. If you are the team leader of a project, you look at what your members within the team do not have, and you pair them together to achieve that. Okay. All right. Okay. And then you look at a review of the care plan. Have you met your agreed outcomes? Are you able to track or meet them? Has a review of the care plan been made or adapted to reflect on the changes made and caregiving? Are more services used being, have you been able to access a wider range of resources? These are very important things that you need to look into. Okay. So, Okay, so today we've had a lecture in the contribution that have been made to enhance partnership working, strengths and weaknesses of partnership working, ways to improve your own practice, and some points that will help us review the effectiveness of partnership working. Are we together? You can find references on your model, whether you want to look into the NHS England UK, Class BJ 2014, Rashid E. Heritage A. Irvin. You can look at the Bridge Support Org. These are all the information that you can look into to gather more information. There's SCI Research Briefing, the NHS England I've mentioned, and various that you can look into. Okay. All right. Today we'll bring today's lectures to an end. We'll continue next time. Okay. All right. Thank you.